So sleep dentistry, very simply put, is having the patient in a sleep-like form while we carry out our dental procedure. This is achieved by administering sedatives and pain-relieving drugs to the patient intravenously by a specialist. There are a number of reasons as to why a patient may opt for sleep dentistry. The main ones are obviously if the patient is very anxious, and so this really takes out the anxiety factor from coming into the dentist. The patient is completely asleep for the procedure and they have no memory of the procedure carried out and they wake up at the end of it. But we also carry out sleep dentistry for procedures that are particularly invasive, like having wisdom teeth removed or having implants placed. Some of the common misconceptions about sleep dentistry that I've heard are that it's super expensive. There is a cost associated with sleep dentistry. A lot of patients are surprised at how affordable it is. Medicare also pays a portion of that cost. Some of the other ones I've heard are that it's not for all procedures. In fact, we do sleep dentistry for procedures as simple as fillings and cleans. We tailor the treatment plan according to what the patient requires and what their needs are. Some others might be that it really knocks you out for days on end, which is not true. You are a bit groggy and a bit sleepy for that particular day that you have the treatment done on, but you're pretty much back to normal the very next day. One other misconception that I've come across is that it is dangerous. In fact, sleep dentistry, or intravenous sedation as we call it, is one of the safest forms of sedation, which is why we can carry this out outside of a hospital at our dental clinic. The process of carrying out sleep dentistry is that the patient is put to sleep by our specialist, a very highly trained specialist, and they go into a very deep sleep, almost like a deep relaxation. We then carry out our dental procedure. We numb the patient up with local anesthetic for the procedure, so a lot of patients wake up feeling very numb in their mouth, and that's because we've numbed them up. And the patients have no memory of the procedure that's been carried out by us, and they feel like they've had a very deep, satisfying sleep when they wake up. We can carry out basically any procedure under sleep dentistry. We do procedures as simple as fillings and cleans for some patients. We do things like wisdom teeth extractions and implants, which are very invasive procedures. So it's a range of treatments that we can provide to the patient. Obviously, each patient is different and we assess every case individually, and we tailor-make treatment plans for every patient.